Hello, I'm Llewellyn King, the host of CFS Alert. Thank you for coming along. Today we have an extraordinary guest. She is Tracey Welson-Rossman, founder and CEO of Journal My Health. And she has been studying and created this unique app on the internet, studying long-haul COVID. And we all know that long-haul COVID has many symptoms identical or overlaying those of myalgic encephalomyelitis. Some people believe it is the same disease. Certainly it has filled patients of ME with a sort of horror that many more will be afflicted with what they've been afflicted with, but also some encouragement that finally there will be sufficient money devoted to the study of long-haul COVID and ME. Tracy, welcome to the broadcast. Tell us a little bit about yourself. You've spent a lifetime in high tech, started several things, been a women's advocate, and tell us more.
Well, thank you so much for having me today and allowing me to tell a little bit of my story. So, I have a sort of a roundabout way of getting to this piece of my journey. But Journal My Health came from my own experiences. And I know this may sound strange that a car accident has led me to develop an app that could work for people with all different types of chronic conditions. But there are a lot of similarities in terms of the health journey that you go on. Now, this is about 20 years ago. There was no smartphone. But what I learned during that time period of getting a diagnosis around nerve condition that, honestly, a lot of doctors didn't believe. Figuring it out, it took about 3 to 4 years. So what I learned was the amount of doctors that you need to go to and really to advocate for yourself, to be able to express my story in a way that whenever I got to a doctor who understood what was happening and wanted to help, that we were able to collaborate. And by the time that the smartphone came out, which is about 12 years ago, and I had my team, I like to say that I was the GC, the general contractor of Tracy's healthcare team. I was talking to my neurologist and I said to him, wouldn't it be great if you could use your smartphone to track all your information? You always have your phone with you. Well, 12 years ago, I wound up starting another concern, which was a nonprofit, and the idea sort of went by the wayside. Last year, when the coronavirus struck, we had some time. I work at a technology consulting firm. My team had some time to experiment with some crazy ideas. I brought this one out. And what was interesting, I had done some research 12 years ago to see what the market was like. And what was interesting was that the market for symptom tracking apps, for the idea of what was happening with chronic conditions, and this was a little bit before long COVID had started to come into the news. The market hadn't changed that much, except that there were more people who were identifying as people with chronic conditions. So we decided to, go down the path. We had better tools. There's more acceptance of putting your information into your phone. But the thing that struck me the most was the idea that we have this data. We give out our data all the time, whether it's through social media apps or shopping apps, and other people are using that data to understand more about us. So why can't we use our own data to help us tell our health stories in a better way?
That is very important, and data is very important. The extraordinary dedicated organizations of the ME, chronic fatigue syndrome world, are all collecting data, because in the data may be the narrative that will lead to the cure, or at least to a viable therapy, which there isn't for those people at present. One of the problems, of course, that anybody who is suffering from ME, shorter for myalgic encephalomyelitis, also known as chronic fatigue syndrome, also is rather dysfunctional. There's a certain amount of intellectual haze that goes along with this and terrible disease. And will people be able to manage the app and remember to work it? Does that become routine, like washing your face in the morning?
Well, we hope that that's going to happen. One of the things that I have a lot of advisors. I'm very lucky. We're in Philadelphia. We are a healthcare mecca, not only just from the hospital standpoint, but also from biotechs and a lot of other healthcare tech companies that have been founded here. So I have a ton of people I get to talk to. One of the points that has come up is, will people continue to put their information? And that's something that we're going to have to work on in terms of consistency. Right now, what we do have are reminders that we can put into the app to get somebody to, to bring up at a certain period of time. You can go back in and you can put that information in at another, if it's the next day, it's not like you have to put it in. If it's the 13th, you have to put it in the 13th.
And what sort of information do you put in?
So currently we have two ways for you to get information into the app. One is self-reporting, and it's pretty simple right now. As we get bigger, we'll add more things in. And it's, even though we are looking at long COVID as our first cohort, it's not specific to long COVID. It can be good for any chronic condition. So we're tracking, how you feel, your stress level, putting in your sleep, your medications, your treatments. We also have a place where you can put free text information if you wanted to write your doctor's appointment. And then you can connect to the weather app. So we're drawing information that's already being collected. And also, because as somebody with chronic pain, I know that the weather has effects on my joints, and I'm not sure what other conditions weather can impact.
Tell us quickly about your own condition, which is a result of a car accident, I understand.
So I have something called RSD, which is reflexive symptomatic disorder, which is basically a nerve disorder. Plus I have some other things, and I've been able to manage it. I'm pretty lucky in terms of getting to a level where it's really background noise for me with an occasional flare up. So I'm fortunate in that way, but you have to be vigilant.
Back to Journal My Health, is it?
Journal My Health, yes.
Journal My Health. Is there a place for people to put their narratives in? We have learned from Facebook that in the ME cohort, people are so lonely. They love to communicate, and each other's stories are sustaining for them. They tell a tale of what other people do to survive, but also that they're not alone. If you publish your own story, right, and then you see similar stories, the sense of such terrible, crushing loneliness is somewhat dissipated.
So right now we are debating whether we'll be doing a community. Based on my background, I think it would be better for us to work with existing communities rather than create our own. So, sometimes you don't need to reinvent the wheel. There's so many communities that are already existing. How can we work with them to provide more information to the people that are out there, and then they could share some of the findings?
I suppose that you could use the app to reference, if not to just to reference, to put a link to a Facebook page or a LinkedIn entry or something like that.
Correct, you could. One of the other things that we have in the app, besides collecting information from the weather app, is that right now we can connect either to the Apple Watch or Fitbit. So we're taking in information again that you're collecting. And then we take that data, that self-reported data, and that passive subjective data, and we're able to create, you can compare two variables, and that creates a chart or a graph. And all of that information can be created in a PDF and sent to somebody else on your healthcare team, whether that is, a family member or a clinician.
A couple of points coming out of what you've said. One, you're not alone in going to 12 doctors. Most people in
Yes.
the ME cohort go to at least 12 doctors to get initially diagnosed. And this has included doctors who have the disease. It is so hard to diagnose, and because it takes time, doctors are reluctant to do it and inclined to misdiagnose because there are some symptoms that fit some other problem, but not the exact symptoms that identify ME and all that flows from that.
So
the
sorry,
other matter, which I think is awfully important, is the business of recording what helps you.
Yes.
I once put out on this program a request for how do you get through the day for very sick people, and I got thousands. I couldn't respond to all of them, but they included things like get a cat, or one woman wrote a wonderful book about just watching a snail in a terrarium because she was too sick to do anything else, but she then wrote a book about the habits of the snail. These things are very important. Cats, for example, generally, if you're very ill, are better pets than dogs because dogs have to be walked. Although,
right.
I'm a dog person myself, and I would love to have a dog if I were ill, but there are limitations, and they're just simple things that people do. One patient who finds total submersion in cold water helps in a lake. Everyone has their own way of getting through this horrendous disease. And as so many of the long haul symptoms are exactly the same as the symptoms for ME, this is going to be very important.
Exactly. You touched on a couple points. One is individual. These are what works for you as an individual. It may help somebody else, but what we've seen in our research of apps that are out there, many of them, in fact, I would say the majority of them, are coming at it from a clinician standpoint. It is for the clinician, and the patient is just inputting information. Because I'm coming at it from a patient standpoint, from my experience, we want to have a way for patients to be able to collect this data, and then when they go to the doctor, to talk about themselves as individuals and what's working for them and what's happening for them. One of my experiences with one of my doctors, somebody that I trusted, there was a medication that he put me on that was, it's what got me through, but it interacted with another medication that I was taking. Well, that wasn't part of what the side effects were supposed to be. So he was dismissive of it because I didn't have information to showcase. I may have been that 0.00001% of the population where this impacted me because I'm an individual. And one of the things that I think we're going to see as I've been out into the broader healthcare community is patients are asking, and I think this is what you were referring to earlier, the long COVID movement, as I would like to call it, these patients, these groups are really pushing the idea that we need to pay attention to what the patient has to say, that the patient is individual, and that we need to, figure out how to take their information and get it over to the doctors to help the doctor with his diagnosis. Long COVID, CFS, some of these chronic conditions, they don't present normally. It takes a while to figure it out. So how do we help the doctors and other healthcare providers, give them more clues as they're doing their detective work? I'd like to bring up another point because we did speak to a couple people within the CFS community as we're creating, and I hope to talk to more patients because it only makes our product better. The idea of journaling, anecdotally, we know that patients within the chronic care community, whether it's long COVID, CFS, or other chronic conditions, they are journaling. They are writing. They are, whether it's handwritten notes, whether it's the Notes app on Apple Watch, on their iPhone, or a bigger electronic program that you've put together. What we're seeing is that journaling, that information is then brought to the doctor, and because it's not in a standardized way, and it can be mountains of information, it's hard for the doctor to actually use that information, because honestly, you only get 20-25 minutes with them. One of the things that we've noticed in our research is that there is very, very little information, studies that have been done about the impact of journals, of keeping healthcare records of yourself, and the impact that it has on an individual's care. And that to me is a shame. It is, I really don't understand how all this information is being taken, and we would like to be able to do a survey in the next couple months to see how many people are actually journaling.
If somebody's journaling, how user-friendly is the app?
Well, we have set out to make it as user-friendly as possible. Certainly, there will be updates and information that we'll get once users are in there, and we're looking for that feedback. But coming from the technology background, we are working with a designer who's very, very sensitive to how a customer is going to use it. It's very important for us.
Now, the journal doesn't absolutely have to be kept current, but supposing you were to be fairly disciplined about it and make regular entries, how long would it take?
On a daily basis, it really only takes a couple minutes. And except if you're putting in notes. I mean, if you're putting in extensive notes, then it's going to take longer, but that's up to you. We're really trying to make it as easy for somebody to come back and continue to do it. And then on the other side, we're hoping to speak to the clinicians, and we have had conversations with clinicians, but we understand that they are part of this chain, even though they're not the end customer. They're somebody that we need to pay attention to. So we want to set up some new meetings with a round of clinicians and ask them about, what information are you looking for? How can we better put this information so that it's easier for you to read? And then, we're hoping that feedback loop of, if you're bringing that information to the doctor and the doctor says, this is really great, thank you for bringing this, we believe that will, get people in the habit.
Are you planning to store and analyze the data you get through? Are you going to put it on the cloud? Is it going to be there accessible? If you get a lot of data, it becomes very significant and can tell a lot.
So right now, what we can do, we want to be very cautious and really thoughtful about how the data is being stored. So the data is anonymized. So your data is put into an aggregate on the cloud, but it is not associated with you. And we are working through that idea. But yes, there will be a pool of data, but privacy for us is going to be of the utmost importance.
And how long has this been going on? Let's ask it that way. How long since you started the app?
The app has been in the stores for 3 months.
And what sort of response have you had from long haul patients?
Well, right now it's a mix of people. We need to, collect more information on the individuals, but in terms of response, we have about 1,000 people who have downloaded the app. And, the more people that we have, we'll start doing some surveys and really having a better understanding of how people are using it. But
Are people using it fairly regularly? Those who've signed up, do they appear to be regular journalists, or they're doing their journaling in a systematic way, or they start and fall
off? So right now what we're seeing is based on what is regular for mobile apps, it looks like we are at that a little bit above average in terms of usership. I'm sure that the more people who download it will see, coming to the median of what's out there. But we hope to, again, be putting in some behavioral modifications so that we can get people to, use it on a consistent basis.
And can you access it through a computer as well as a cell phone?
Not yet. So right now it is just available on a mobile device, also iPads, tablets, but we are looking to create a digital platform.
Now let's get the information so people can get in touch with you. It is Journal My Health, and you are Tracey Welson-Rossman.
Yes.
And you operate out of Philadelphia. And is there an email address we can put on the screen?
Sure. info@journalmyhealth.com.
I'm going to repeat that, info@journalmyhealth.com. And that will get to your small company or small organization.
That will get directly to me right now. So.
Okay, so we see how small it is.
Yes.
Well, no, that's fine.
We all have to start someplace, but we do have.
Indubitably, absolutely.
Right.
Tell us a little bit about yourself, Tracy. You are a mother.
So I am married, almost 31 years. I have two sons who are out in the world doing their professional things, which is great. And I've had a varied career, starting off in retail, taking that experience, going into advertising sales. And then I went down the entrepreneurial path. My husband and I purchased a business back in child transportation well before Uber and Lyft were available. And from there, I realized that I liked working in smaller companies and doing things that were disruptive, and lucked into meeting a group of people who were in the software industry. We formed a company a couple years after another company that we had all been together, which is the current company that I actually have two jobs. So I work at a software development company, which is 19 years old. So those resources, my developers have helped develop the app. So I know that I'm very fortunate to have great technologists on my team, which is really important. And I also created a nonprofit to help get more girls into.
Tell us a little bit about that. And I saw that you spelled girls with a Z.
With a Z. Yes. Well, that was because the S was taken on the .com URL. So, but it set us apart. So Tech Girls, which is now 12 years old, I created that because of what I was seeing happening at my own company, which was not a lot of women coming in and applying for jobs. And I didn't understand why, because there's so much flexibility. It's exciting. You're working with disruptive technologies. So, like any good entrepreneur, did the research and began to understand that girls were self-selecting out of technology careers starting at about 9th grade. So we created my team and I had some people who were on an advisory committee to start in the first year, spent a year in planning. We decided to work with middle school girls and create these short interactive workshops that were taught by people in the industry. And the organization grew, and in the 10th year, it actually was acquired by a larger nonprofit, which is taking it to the next level. And, you know, I sit on the board, and this group has been working through COVID, doing things online.
That's very interesting,
yeah.
and it's of interesting to the audience to this broadcast because sadly, a majority of the sufferers from ME, CFS appear to be women. In fact, the majority is women, and their isolation is something awful, and every kind of ache, every kind of pain, and I hope the COVID people don't suffer this way. It's a life sentence. Without much remediation in it. I thank you so much for coming on the broadcast. What you're doing is very exciting, I think very important. I hope that some of the advocacy organizations in the ME community get in touch with you, and I'll be happy to provide their names to you if you should want to do that.
That would be great, because we really want to provide a tool that is helpful.
They say in commerce, the data is the new oil. Let's hope it's the new remedy.
Exactly. Thank you.
Thank you very much.